Okay, hello to all of you. Let's continue with chapter number 19. So we were at this slide and we were talking about tuberculosis, which can be extrapulmonary, and we talked about it. This infection can go to kidneys, it can go to bones, it can go to genital tract, it can also go to brain and meninges. So now, secondary or reactivation of tuberculosis, live bacteria can remain dormant and then reactivate. So it's possible that the bacteria becomes dormant and then it can reactivate at some other phase of the life. Chronic tuberculosis, tubercles expand, causing cavities into the lungs and drain into the bronchial tubes and upper respiratory tract. So these are some of the symptoms. Violent coughing with greenish or bloody sputum, low-grade fever, anorexia, weight loss, extreme fatigue, night sweats, and chest pain. Now, the causative agent of tuberculosis is the bacterium called Mycobacterium tuberculosis, and it is an acid-fast bacillus. It's a strict aerobe and slow-growing. It has mycolic acid and waxes in their cell walls. It is resistant to drying and disinfectants. So basically, for the diagnosis of tuberculosis, there is a test which is called Montauk's test, or it's also called a skin test. In this test, basically, this PPD, which is a purified protein derivative, is injected under the skin, and then after few days, basically, it is checked that how much eruption is there, and its diameter is measured, and on the basis of that, it can be determined if the person is suffering from tuberculosis or not. So this is called Montauk's test, or it is also called skin test. And PPD, which is purified protein derivative, is injected under the skin, and after 48 to 72 hours, it is checked. The eruptions are checked. So it can be 5 to 9 mm bleb positive if person is in category 1, 10 to 14 bleb positive if person is in category 2, 15 mm bleb positive if person is in category 3. And then this is another test which can be done, which is called interferon gamma release assays, performed on blood sample. Then culture isolation and antimicrobial susceptibility. This is also done for the diagnosis of tuberculosis. And acid fast staining is done for staining this bacterium. Tuberculosis prevention, limiting exposure to infectious airborne particles. Patients are put into negative pressure rooms, and the vaccine which is used is called BCG. And this is the name of some of the drugs which are given to the patients suffering from tuberculosis. This is rifampin and rifapentine. So it's rifampin and rifapentine, and these drugs are given for a long time period. Isoniazid 9 months. So these two drugs are given for 4 to 3 months. So these drugs are given for the treatment of latent tuberculosis, and these are the drugs. These drugs, they're given for the treatment of active tuberculosis. Now the next is pneumonia. So pneumonia is basically an inflammatory condition of the lungs in which fluid fills the alveoli, and there are a wide variety of organisms which can cause pneumonia. So it includes Streptococcus pneumoniae, which is a bacteria, then Legionella, then Mycoplasma pneumoniae, and Chlamydophila pneumoniae. So these are different organisms. Then Hantavirus, they can cause this Histoplasma capsulatum. This is a fungus. So these are bacteria, viruses, fungus. They can all cause pneumonia. So here are some details. I'm going to talk about just some of the important things. So first of all, the pneumonia caused by Streptococcus pneumoniae, or these bacteria are also called pneumococcus. So these are small gram-positive flattened coccus, and so these are some of the factors that favor the ability of the bacteria to cause a disease, like old age, the season, diabetes. Then Legionella pneumophila. So this is basically gram-negative bacteria that ranges from coccus to filaments, able to survive and persist in natural habitats. And the next is by Mycoplasma and Chlamydophila. So this is symptoms do not resemble those of the pneumococcal or other severe pneumonia. So that is why this is called atypical pneumonias. Then the pneumonia caused by hantavirus, and this hantavirus belongs to this family called Bunniaviridae family, and these are enveloped viruses. Then Histoplasma capsulatum, they also cause pneumonia. Then the next one is Pneumocystis carini girovecii. So they also cause these are agents of pneumocystis pneumonia. And then there are some viruses which can also cause pneumonia. Very common cause of community-acquired pneumonia. Important thing to know here is viral pneumonias are generally mild. Okay, so that's all which finishes this chapter. If you have any question, please let me know.